Hello, fellow EOTR assistants. This is Ashley, lead assistant at Endodontics of the Rockies. I am going to show you how to do a chart today. So we're just going to dive right into this. I'm using Mickey Mouse as my patient. So I start from here, work my way down, start from here, work my way down. So right here, you're going to start a new case. Today we have Mickey Mouse coming in for a root canal on tooth number 30. He told me that he has been having pain for 3 days. Started antibiotic yesterday. Keeps me up at night. Cold and heat sensitive. Ibuprofen kind of helps. Okay, so just a generic chief complaint. This is it in the patient's voice. So you're going to write it as if you are the patient. Okay. So hit OK, and then you're going to come down here. Vital signs, you're going to put their blood pressure here. RX, this is if the doctor needs us to prescribe any medication. You'll go to ERX for e-prescribe, and then you'll see it pop up here. We'll do that in a different video. And then this is the testing. So you're going to hit New, and you're going to select the teeth that we're going to be testing. So since we're doing number 30, I'm so sorry, you're going to hear my dogs in the background. So since we're doing number 30, we are also going to test 31 and 29 because we want to see what a normal tooth tests like in his mouth. So don't use anything else, just click on the teeth. Make sure if there's not a tooth there, if it's extracted, you skip that tooth and go to the next one. There's nothing worse than when we have testing in there on a tooth that doesn't even exist. So hit OK. And then you're just going to go through all of these, whatever the doctor does. Every doctor has their own routine, their own process. Percussion, we'll say 1+, but it could be with a normal. So whatever the doctor says, symptomatic, let's see, palpation, we'll do lingual. So palpation is when they rub the outside of the gums. Cold, how's it responding to cold? We'll put, plus lingering. Heat, we don't usually do. Sometimes we do. Biting is tooth sleuth, so you'll just go ahead and go down. So you want to fill out as much of this as you possibly can. So definitely in these areas especially. And then down here, utilize notes if you need to. The biggest thing is make sure all the testing is in there for every single tooth. If you don't know if they tested it, ask the doctor. So you're going to check this tooth off because that's the one we're going to treat. Save. And then it's going to bring you up here. Our first instinct is to hit New. Do not do that. You're going to leave this because we selected 30. If you hit New, it's going to bring up a different tooth. So you'll see it says, add a new tooth to be treated as part of this case. You don't want to do that. Hit DX for diagnose. So enter diagnosis data for this case. Okay, so we're going to diagnose this. We are, we've gone over diagnosing in a different video. So I'm just going to fill this out really quick. Okay, so you're going to see 30 and all 3 diagnoses. Okay, so now you're going to go to treatment and we're going to do a clicky chart. I have dubbed this clicky chart. So if you hear anybody say clicky chart, that's what this is. Do the drop down, do not hit New. Drop down, go down to root canal therapy. Okay, and you're just going to click away. You're going to fill this out. Make sure you read everything before you click. So today's treatment, we did root canal started and completed. Dr. Griffin, we'll put me. Yes, we always take a pre-op x-ray. We recommended a root canal. Of course, we give them their other options, extraction, implant, yada yada. Yes, we always review their medical history. We discuss the risks and benefits. We do not treat people unless we have consent. Always make sure you have consent. Antibiotic prophylaxis. That's if somebody has to take a pre-med prior to coming in. Pulpal status. So when we get inside the tooth, doctor is going to say necrosis confirmed, hyperemic pulp confirmed, whatever it is. So in this case, the tooth is inflamed. So chances of it being vital inflamed are a lot higher. So if they say hyperemic pulp, that means that it is bloody. Let's see, checked probing depths. Yes, we did. Rubber dam every time. Cleaned and shaped. Yes. So you'll see partial in there, and that's if we don't finish same day. Occlusal reduction. No, we didn't do that today. Since the tooth is not necrotic, I won't select that one. I'm going to do hypo and EDTA. We are not using BioPure because it's not necrotic. Okay, obturation material. Occasionally we'll use MTA, but typically it's just gutta percha. Obstruction, the doctor will tell you. If they don't tell you, you have to ask if there was an obstruction and where it was. Typically, it's all canals. If there's pulp stones present, it's usually all. We did not do internal bleaching. Since it is a molar, we're going to do purple permaflow. We always do sponge and cavit or just cavit. We do not do cotton and cavit. Post-space, no. Written and verbal post-op instructions. Yes, we took a post-op x-ray. Our next visit would be a 1-year recall. Now, this patient could come in 6 months and say, hey, Dr. Griffin, my tooth is hurting. I don't think this is normal. Can you check it? Yes, we have a 1-year warranty on this tooth. So we will check it as many times, hopefully not a lot, but we will check it for the patient at no charge, at no cost. We're not going to have them pay for this visit. So just consider a case. So up here where we did a case, consider that the start of the 1-year warranty. Okay. So you're going to see their blood pressure here, and then we need to put the anesthetic in here. So he uses Septicaine and Marcaine, which is bupivacaine. The amount is here, so we used 1 carpule, or you can select it and put 2. And then since it's a lower, we'll do block. Okay, we're going to save that, exit, and lastly, you're going to do a narrative. So you'll go up to EHR narratives up here. This screen pops up. Let's hit new. Okay, and then you're going to open template, scroll down to root canal. Choose. Do not double click, just select choose. And then you're going to go to power merge. Do not do merge, just do power merge. It's a powerful merge. So this is going to merge all of the patient's information into the narrative. I always bring that down. It just looks a lot more organized and professional. Make sure the tooth number is here. So you're going to put patient's chief complaint in your own verbiage, because it's going to be a lot more, I don't know, like we're going to be using a lot of our jargon. So you're going to want to put the patient's chief complaint in your own words here. Second paragraph is testing, recommendation, and consent. We need to know what the testing was, what the recommendation was, if the patient signed consent, and if they understood and signed the additional fees, whether that's comfort package or nitrous or whatever. And then you're going to put your treatment story notes, essentially. So you're going to explain the entire procedure from start to finish here. Now, if you put it into the clicky chart, chances are you're not going to put it in the narrative. So make sure you're not doing double work. At the end, you'll always put NV for next visit. And then in this case, we'll do 1 YRC for 1-year recall. Sometimes you'll do a 10-minute check. You can do a check, or you'll do post-op, whatever it is. Okay, you'll write it there, and then you're always going to do a backslash with your initials. Okay, so we're going to close out of this and hit save, and that is how you do a chart for a patient. I know it seems like a lot, but this is going to be the best for the patient. If you have any questions about any of this, just go ahead and ask your fellow assistants, ask the doctors, but I think you guys are going to do great.